and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Kara Arnold and Jennifer Dimoff. Kara is a professor of organizational behavior at Memorial University in St. John's, Newfoundland, Canada. And Jennifer is an assistant professor of organizational behavior and human resources at the University of Ottawa, also in Canada. Kara and Jennifer, welcome to the show.
Thank you so much for having us, Kevin.
So we'll get into your article in a little bit, but first off, I'm going to ask each of you to share your story and your journey to where you are today. Kara, can you go first?
Sure. So I'm Kara Arnold, and I'm like you say, professor in organizational behavior here at the Faculty of Business at Memorial University. And I study the intersection of leadership and well-being from an employee point of view, mostly in the past, but I've shifted to look at leaders' well-being and how that is also can be important in terms of how leaders lead, whether they can be positive in those positions or not. I came to academia from a very roundabout route. I thought I wanted to be a clinical psychologist and then sort of took a different path. And I found organizational behavior as I did my MBA. And I did a lot of odd different jobs here and there, working for different places and many different kinds of bosses. And I really, when I got to the point where I was studying about leadership, I was really interested in how leaders' behavior impacts on employees' attitudes. So that's how I ended up here.
So Kara, for my clinician audience on the show, can you explain what organizational behavior is?
I would say that it's really the application of the principles of psychology, sociology, human behavior to the organizational setting. So there's a lot of psychology involved in what I study because I study it from what's called the micro point of view, which is more individual based.
All right. And Jennifer, can you share your story and your journey to where you are today?
Yes, mine is also a bit unorthodox like Kara's. I started out, my bachelor's degree is actually in biology and very heavy on the physical sciences. And I thought I wanted to be a medical doctor. I'm the only non-doctor doctor in my family, all physicians and mostly GPs. And so my PhD is actually in a field called industrial organizational psychology, which is basically the study of people at work and people and their interactions with the workplace. And through my kind of, biological background and training in that, I was really interested in the impact that the workplace can have on these more physiological systems and neurological systems. And so I've been really kind of studying the intersection between leadership, mental health and mental illness, and occupational safety and health in general in workplace environments. And I've done some work with healthcare organizations and workers. And from, as I said, from a personal perspective, I'm the only non-doctor doctor in my family and like to stay as close to the phenomenon as I possibly can to really ensure that the research that I'm doing is impacting practice, but as part of that I'm really listening to what's going on in practice so that I can use that to inform research questions that are actually going to make a difference to people, who are on the front lines or who have boots on the ground.
Fantastic. And I'm looking forward to further discussing that intersection between organizational behavior and healthcare today. So let's get into your Kevin MD article, How to Be a Transformational Supportive Leader during COVID-19. Kara, for those who didn't read that article, can you just walk my audience through it and maybe share the story of why you and Jennifer decided to co-write it?
So the article really came together as a result of a partnership grant that's being led by Dr. Ivy Bourgeau, who's also at the University of Ottawa. And she's a leading expert in public health, gender, and women's issues, especially within the context of healthcare. And through the grant, she assembled an amazing team of experts. Our role in the grant, we're really looking at how leadership intersects across a number of different professions. And we're particularly interested in looking at that through a gendered lens.
So what's really unique about this larger study, this partnership grant that's facilitated through two really large granting agencies in Canada, is that it's really focused on the experience of professionals. And so much research in organizational behavior and in industrial organizational psychology is not as targeted at professionals, physicians, accountants, people who fall under a profession umbrella. So it's really unique to be looking at those particular populations and the experiences that they have with that intersection between mental health and mental illness and return to work. And we're part of a leadership team that's part of that grant. So Kara and Amanda, the other co-author, and I really very focused on the impact that leaders have on their employees in terms of supporting their mental health and well-being, but also on the impact that employees can have on their leaders. So it's this kind of reciprocal relationship where the more leaders understand about the behaviors that are going to make a tangible difference for employees' general well-being, the more they can make a difference to help mitigate mental illness and improve mental health, and in turn, result in a more psychologically healthy workplace environment.
So Jennifer, what are some of the specific characteristics, traits, and techniques leaders should have, especially guiding their organizations during the pandemic?
Sure. So it's been interesting. There have been a couple of kind of studies that have looked at gender in terms of mortality rates. So there's a study published recently about governors who were women and had lower levels of mortality rates in their areas than governors who are leaders who were men. So there's that kind of trait-based, perspective on this with the pandemic, just looking at one demographic variable of gender. But what a lot of the research that we tend to do is less, or at least that I tend to do, is less on the trait side and more on the behavior side. Because often leaders are in roles that they may not have been actively selected to be in. So there's not necessarily we can do anything about who they are, but we can do something about what they do. So this is about training the behaviors so that they can be more supportive. And a lot of that comes down to, and you'll see this in the article, of emotionally supportive leadership behaviors and instrumentally supportive leadership behaviors. So from an emotional support perspective, it's really about doing the little things that show you care, and not just about the person as a worker, but as a whole person. So getting to know them, asking about their families, understanding their home challenges or their personal challenges, as well as their work challenges, by doing simple things like asking how they're doing on a regular basis and actively listening when they tell you how they're doing. Looking to sometimes read between the lines, because sometimes people will say, oh yeah, everything's great. We had a great time looking for, Christmas trees with the kids over the weekend, or we're planning for Thanksgiving. And other times they're saying exactly the same thing, but very differently. So saying, oh yeah, we were, really excited about Thanksgiving, and yeah, the kids, and we went for looking for Christmas trees. So it's really about training people to recognize those nuances and then follow up on them by providing things like instrumental support, which is really about making sure that people have access to the resources that they need to be as healthy as possible. So providing employee assistance programs if you're in a position to do that, encouraging people to use benefits for psychological as well as physical health and well-being. And then instrumental support is also just about providing people with the tools they need to do the job. So whether that's providing PPE, providing training on telehealth, making sure that the telehealth options are as robust as possible for people who this is a new experience for. And that applies in all industries, not just in healthcare, but certainly they need the tools to do the job. And that can help to alleviate a lot of stress that people are experiencing right now.
Kara, we are entering almost the ninth or 10th month of the pandemic, and I was wondering from a healthcare leadership standpoint, have you seen any missed opportunities that leaders aren't taking to help support their groups during the pandemic?
The leaders in our healthcare systems are, doing their absolute utmost to, serve their patients, to help those who are in need right now. Probably one of the things which I think we kind of alluded to earlier is, as a leader, your behaviors influence your employees. I would say, in healthcare, your behaviors also are influencing your patients, right? But it's also really important, I think, at this time for leaders in healthcare in particular, I think all leaders, but particularly in healthcare at this point, to take care of themselves as well.
Mhm.
So being able to think about taking that step back, maybe making that time that you need to make for yourself, because being in a leadership role has, always had some maybe, additional stresses that people experience. But I think in, the context of today's world with the pandemic, that's probably tenfold what it was. So to really allow yourself to just say, you know what, I need to take a step back. I need to take care of myself at this moment in time, as well as my employees and my patients. I think that that would be something that, a lot of times I think leaders don't necessarily think about or actively, do for themselves.
And Kara, what kind of advice do you have for leaders going forward? And what do you think some of the challenges that they may face in the coming months?
One of the things I think, and I mean, for some, clinicians, it will be, in terms of that interaction, virtual
Mhm.
interaction, if you're having virtual interactions with either your patients or with your employees, and how do we do that as effectively as we used to do in person? And, to be honest, in terms of our research, we don't know a lot about that, but I think that's sort of one thing going forward that, we need to think about.
I think that I think this is the nature of this beast, is that it is an ever evolving. When we were first writing this article and when we were first starting on this research, it was March and April. And some of the research studies that we've conceptualized and that I've been a part of over the last 7 months look very different than how we thought they would 7 months ago, even in terms of the variables that we're capturing. So, one of the really interesting phenomenons that we've seen that I would kind of implore leaders to pay attention to is this unprecedented reality that we're all dealing with right now, especially in healthcare, where we have this unique combination of stressors, where we have daily hassles. So the little things that are mostly we cope with on a regular basis, they're kind of annoyances, but we have those morphing into chronic stressors, so the bigger things that are causing the more chronic health issues. Then we have catastrophic and traumatic stressors occurring with loss of life and fear of loss of life, and no very crystal clear end in sight. And just recognizing that and internalizing that this is day by day and communicating that with people, providing transparency and communication as much as possible with your people. That's something that certainly some of the other work that I've been doing this summer on COVID, and we have stuff from healthcare workers, both physicians, nurses, long-term care providers. That's the one thing they've been saying is most appreciated, certainly from administration, is just transparency. Even if it's
Mhm.
bad news, it's better than no news. So even if it's, we have PPE for the next 3 months, and then people did better with that than not having any information about it at all. So transparency where possible seems to be really appreciated by people, and that generally tends to lead to lower levels of strain.
We're talking to Kara Arnold and Jennifer Dimoff. Kara is a professor of organizational behavior at Memorial University in St. John's, Newfoundland, Canada. And Jennifer is an assistant professor of organizational behavior and human resources at the University of Ottawa, also in Canada. Now, I'm going to end with asking you both the same question, your take-home message to the Kevin MD audience. Jennifer, why don't you go first?
I think the biggest and kind of one sentence is In order to lead well, you have to be well yourself.
Wonderful. And Kara, what is your take-home message to the Kevin MD audience?
I'm going to be very unoriginal and just underline what Jennifer has said. It's one of the main things that we know from the research is the better that we are in terms of our own health as leaders, the more be there for our employees, and that's really what it's all about. So.
Fantastic. Well, thank you both for sharing your time and insight, and thanks again for being on the show.
Thank you.
Thank you. Thanks for having us.